Good afternoon and welcome to the review of a proposal. I am Maria Mikhataykina, a nurse, a healthcare leader, a patient, and a student of a DBA program. Thank you for a great opportunity to present my proposal. I would like to take a minute and recognize my chair, Irene Williams, and co-chair, Charlie Shao, for their dedication and support in my research. My passion lies to serve others and expand access to high-quality healthcare. Unfortunately, we are far away from making it a reality. Cost is one of the challenges that I would like to concentrate my research on and look for potential correlations between the variables. The title of my work is The Relationship Between Length of Stay, Hospital Characteristics, and Cost of Care. Next slide, please. In 2018, US healthcare spending reached $3.6 trillion, equivalent to nearly 18% of GDP. An extended hospital stay is the leading part of medical costs for healthcare organizations, insurance companies, and patients, leading to medical complications and other costly, highly specialized care. The researchers have found that some hospital characteristics may influence the length of stay and may predict the cost of care. Little knowledge exists about the correlations between specific hospital characteristics such as hospital size, discharge volume, location, teaching status, hospital ownership, or any above on length of stay and healthcare cost. Understanding the relationship may help hospitals to improve strategic planning and adjust business models to promote decrease in healthcare costs and increase profits. In addition, the knowledge gained from the study may promote transparency of healthcare costs to assist in the future healthcare cost reduction initiatives and make high-quality care more accessible. Next slide, please. Problem statement. The purpose of this quantitative correlational study is to examine the relationship between inpatient hospital length of stay, hospital characteristics, and cost of care. The independent variables are the length of stay and hospital characteristics. The dependent variable is cost of care. The target population will consist of community hospitals participating in the nationwide inpatient sample. A research question. What is the relationship between the inpatient hospital length of stay, hospital characteristics, and cost of care? Within my study, I will employ the complex adaptive system theory founded by Holland in 1995. According to Hadimond, the cost theory is not grounded in a specific discipline, allowing me to apply it in the various domains: clinical, operational, social, and financial. Ellis described complex adaptive system as nonlinear, self-organized, relationship-based, and adaptable system. The researchers suggested that CAS theory has significant implications for organizational development and system design, particularly in two complex social networks such as healthcare. Healthcare complexity skyrocketed in the past decade, and we could see it last year more than ever. The CAS approach to review the healthcare system will help to fill the gap, to understand the relationship between clinical, social, operational, and financial networks. The significance of the study as a community, as a healthcare community, the hospitals carry responsibility for ensuring patients are appropriately admitted and cared for within the optimal length of stay. Healthcare leaders will benefit from this quantitative correlational study to better understand what prompts patients to stay in the hospital longer. Healthcare leaders could also use the study results to allocate limited resources, promoting hospital efficiency and maximizing profitability. It may stimulate their coordination models, re-engineering, or even influence health policies to cover better community care at the hospital and their resource utilization. Next slide, please. So to make a complex adaptive system within the research, the healthcare cost is not a novel problem. The researchers around the world, they looked at the complex adaptive system and the growing healthcare cost. Literature review showed that utilization of CAS theoretical framework in Canada, Germany, Belgium, and Australia, they have found similar results where multiple and two complex systems get together. Stamberg and Bircher concluded that complex adaptive system in healthcare allows healthcare workers to fulfill their purpose and drive healthcare costs down. Those particular authors pointed out that the growth of wages above productivity growth goes growing healthcare expenditure. The bottom decision to develop the creativity to find better solutions to decrease and drive the costs down can help within the complex adaptive system theory. Next slide, please. I will obtain data using archival data from the HRQ, Agency for Healthcare Research and Quality. In addition, I will extract data from the Healthcare Cost and Utilization Project, National Inpatient Sample. The NIA's database is federally sponsored and designed as stratified 20% sample of all community hospital discharges. As the largest publicly available all-payer inpatient care database in the United States, the NIS database represents diverse geographical regions and hospital types. The NIS sample contains data on more than 7 million hospital stays each year. The HCUP data set has several limiting factors that I have to consider as my limitations. First, the data does not contain an understanding of the cases, leaving the results open to interpretation. Technological advancements and new programs within each facility may influence how they are treated and coded in the system. Some researchers have argued that any changes post-reform, new programs, learning curves may affect the variation and interpretation of the information. Lastly, the authors within the complex adaptive system theory and HCUP researchers did not finalize single way of theoretical framework. The HCUP data requires additional research. I have found it in multiple studies where the researchers completed retrospective cohort studies to examine differences between the in-hospital mortality groups in a rural, urban teaching or urban non-teaching hospital, as well as public and private hospital. There is multiple data sets that are available and been utilized in several research documents that I have analyzed and reviewed the literature for. I will conduct multiple linear regression and I hope I will see the correlation between length of stay and other indicators. There is several research available already that shows few correlations between gender and hospital admissions. There are some research available that shows size of the hospital and length of stay, but I could not find enough sufficient evidence to show the similar situations where multiple characteristics were combined together. I will conduct multiple linear regression to show the research and hope I will find some answers that I'm looking for to see the correlations and if there is any. The target population will consist of community hospitals participating in NIA's data collection in the United States. I have identified and used G-Power version 3196 to conduct a power analysis and determine the minimum appropriate size for the study to be about 150 hospitals. A prior analysis that I used, I found that it has to be between 134 to 150 hospitals. Examining the relationship between inpatient hospital length of stay, hospital characteristics, and cost of care may contribute to improve hospital business operation. The result may improve healthcare operations by influencing business strategies leading to potential cost savings. Lowering healthcare costs may lead to an increase in patient compliance with treatments and enable healthier people. Next slide, please. I have provided a sample of references to that I used during my initial steps. If you would like to have an extended version, I will be happy to share that. Next slide, please. Based on the feedback that I will receive during this presentation and based on the feedback that I will receive from my chairs and co-chairs, I'm looking forward to finalize my proposal and looking for the approval, and so I can jump to the study and actually look for results and have fun with the data analysis and reviewing the correlations.
Perfect, thank you. Great presentation.